All right. Good evening, everyone. My name is Cassandra Taylor, and I'm the founder and CEO of Top Flight Defense Incorporated, nonprofit organization created to focus on the overall health and mental wellness of women veterans and women in our community. And today we have with us Dr. Bhakta from Rush University Medical Center. And she would like to talk to us about what? Cervical care. So, Dr. Bach, I'm going to turn it over to you.
Good evening. Thank you so much for having me, Cassandra. And thank you all for joining us today and to all of our veterans for your service for our country. Really appreciate all that you've done for us. My name is Dr. Dara Bhakta, and I am an OBGYN, which means that I take care of women and their reproductive organs. Today, we're going to talk a little bit about cervical cancer. I'm going to share my screen and we have a little PowerPoint to go through. See if we can get the slideshow.
If you hit, there you go. There you go.
Okay. Okay, so today we're going to talk about presenting cervical cancer. So let's start with what is a cervix. The cervix is the lower, narrower end of the uterus or the womb that opens during the delivery of a baby. The cervix is what connects the uterus over to the vagina, which is the birth canal. As a brief reminder, women are typically born with a uterus, a cervix, and a vagina. And then women also have fallopian tubes and ovaries. So the ovaries release the eggs every month that can, if fertilized, turn into babies. And they also make the hormones that are very important for women's health. The tubes, the fallopian tubes, transport the egg from the ovary to the uterus. And the uterus is the home for the baby. The uterus is also where the months that women don't have babies, we typically build up a lining and then have a period. And the period exits through this little hole here through the cervix, through the vagina, and out the body. The cervix is typically 3 to 4 centimeters long. The outside of it, the part that we can see through the vagina when we're doing an exam, a pelvic exam, is called the external os, and it looks like this. And then all of this area can open up when we're having a baby. So cervical cancer. The cervix is covered by a thin layer of tissue made up of cells. Cervical cancer occurs when these cells become abnormal. Healthy cells grow, divide, and are replaced as needed, but sometimes this process can grow out of control. And abnormal cells can grow deeper into the layers of the cervix and spread to other organs. The cancer cells eventually form a mass of tissue called a tumor. It takes several years for cervical cancer to develop, and during this time, the cells on or around the cervix become abnormal. The early cell changes that occur before cancer is present are called dysplasia or cervical intraepithelial neoplasia. So these right here, if we look at this picture, are normal cells. And then this is what we call the basement membrane. We start having some abnormal cells here and then more abnormal cells here. So this is mild dysplasia, then moderate dysplasia. And then when these cells break through this line right here, that's when it's actually called cancer. So cervical cancer is the 4th most diagnosed cancer in the entire world and the 4th leading cause of cancer death in women worldwide. Within the United States, we have an estimated 12,000 new cases of cervical cancer that are diagnosed each year. And each year, about 4,000 women in the United States will die from this disease. The main cause of cervical cancer is infection with human papillomavirus, or HPV. There are many types of HPV. Some types have been linked to cancer of the cervix, the vulva, the vagina, and the penis, and the anus. And some can also cause cancer of the head and neck. The types of HPV that can cause cancer are known as the high-risk types, usually type 16 and 18. Cells that are infected with the HPV virus can appear different than normal cells when we look at them under a microscope. Abnormal changes can be mild or they can be serious, and the more serious changes can lead to cancer if they are not treated. HPV can be passed from person to person during sexual activity. HPV is very common. Most women who are sexually transmitted will get HPV at some point in their lifetime. HPV usually does not cause symptoms, and most people do not know that they have HPV. Some research even shows that at least 3 in 4 people who have sex will get genital HPV at some point. However, most people's HPV infections go away on their own. So not everybody that has HPV automatically gets cancer. Only a small number of women with the high-risk types of HPV will get cervical cancer. Because of the body's natural ability to fight infection, most HPV infections actually go away on their own. These short-term infections are typically cause mild or low-grade changes in cervical cells, and eventually the cells will go back to normal as the HPV infection clears. In a small number, the HPV virus does not go away. If the HPV infection lasts for a long time, it is described as a persistent infection. Persistent HPV infection with high-risk HPV types can cause more severe or high-grade changes in cervical cells. High-grade changes that persist for 1 to 2 years are more likely to become cancer if they are not treated. Factors such as cigarette smoking, a weakened immune system, and infection with human immunodeficiency virus, or HIV, are thought to increase the risk of the chance that HPV will persist. But some women who don't have any of these risk factors also have persistent infections. And if anybody at any point has any questions, please feel free to interrupt. So cervical cancer can occur at any age. It occurs most often after age 40, but it can occur at younger ages too. It rarely occurs before the age of 21. Your risk of cervical cancer depends on your sexual history, your immune system, your health, and your lifestyle. The most important risk factor for cervical cancer is infection with the types of HPV or human papillomavirus that are linked to cancer. There are other factors that can also increase your risk of becoming infected with HPV. So having multiple sexual partners, having a male sexual partner who has had multiple sexual partners, having first sex at an early age, sometimes that to be younger than the age of 18, a personal history of abnormal cells of the cervix, vagina, vulva, a family history of cervical cancer, smoking, other sexually transmitted infections such as chlamydia, having a weakened immune system, and then having a mother who took a drug called DES or diethyl bistrol during your pregnancy. Cervical cancer, however, is totally preventable, which is the good, exciting news. The strategy to eliminate cervical cancer includes fully vaccinating all girls at a young age, screening for cervical cancers, and then catching precancers and treating them before they turn into cancer. So one way to protect against HPV infection is by getting the HPV vaccine. The vaccine is safe and effective and protects against the HPV types that are the most common cause of both genital warts and cancer.
Dr. Bhakta, I have a question for you.
Yes, ma'am.
Can you go back one slide, please? Okay,
Yes.
for cervical cancer screening, I
Yeah.
know as women get older, and I know in the military they were saying that it was every 5 years. If you had a normal pap smear, then they would tell you to come back every 5 years. Does the cervical cancer screening, does that change? If you're saying in order to prevent cervical cancer, if we're coming back every 5 years and you are sexually active, how is that going to protect us or prevent us from having the cervical cancer? How can we, you being a doctor, how can we stress to our physician, our doctor, that we need to have this? Is it Simply just telling them that we have multiple partners, or what would your suggestion be?
So that, Cassandra, is an excellent question and a conversation that we have. As many of the older women who are watching this may remember, up until probably 10 years ago, we did pap smears every single year. Um, so we'll address a little bit later about what specifically a pap smear looks at, as well as HPV testing and why some of those guidelines have changed. If it's okay, I will get to that question in just a minute because that's actually included in here.
Sure.
Okay, thanks so much for bringing that up. That's an excellent point, Cassandra. Um, So HPV infection is prevented by getting the HPV vaccine. The vaccine is safe and effective and protects against the HPV types that are the most common cause of warts and cancer. And the vaccine is safe and does not contain a live virus, so it cannot cause an HPV infection. Vaccination works best when it's done before a person is sexually active and exposed to HPV. And vaccination can still reduce the risk of getting HPV for people who've already been sexually active. So we can give the vaccine anyway, starting at the age of 9 and all the way up through 45. So even if you've been sexually active in the past, you can still get the vaccine, and that can prevent you from getting new cases of the virus. And also, when we think about our children and our grandchildren, the best things that we can do to prevent them from getting cervical cancer is getting them vaccinated at age 11 before they've had any sexual activity. For children under the age of 15, it is actually only a 2-dose vaccine. And then for everybody else, it's a 3-dose vaccine series. And as I said, for women, we can do it through the age of 45. Condoms also decrease the risk of genital warts and cervix cancer, and also protect from HIV, such as or infections like HIV, gonorrhea, chlamydia, and trichomonas. And as we said before, HPV is a sexually transmitted infection. So condoms are very, very important. So pap smears. So cervical cancer screening includes both the pap smear, an HPV test, or both. And Cassandra, this is why we've had some of the changes to where we're not doing the screening every year is not recommended. So the pap smear looks at cells under a microscope and looks to see if there's any of those precancerous or dysplastic changes. The HPV test just looks to tell us, is the virus here or not here? Because we know that the virus is a risk factor for precancer and cancer. Under the age of 30, so from 21 to 30, we do recommend getting that pap smear done every 3 years. And the reason that we have recommended spacing it out to 5 years after the age of 30 is because we also have started doing that HPV testing. So that HPV testing, knowing about HPV and being able to test for it, is a relatively new development in science. Before, when we used to do pap smears every year for all women, we found that we were doing a lot of additional tests like biopsies and procedures that were painful, and were not changing the rates of women leading or women getting cervical cancer or dying from cervical cancer. And so when they looked at the data for millions of women over many years, they found that doing that spacing to every 3 to 5 years, because cervical cancer takes such a long time to progress, did not increase women's risk of getting cancer and did not increase their risk of death. But it did save women from getting a lot of unnecessary procedures. And this is because we know that most women's bodies will get rid of the HPV. And for the women that their bodies don't get rid of the HPV, it usually takes anywhere from 3 to 7 years to have any of the cell changes. That being said, all women should feel empowered to talk to their doctor. And if they are concerned, if they feel like they have higher risk factors, or if they just don't want to take any chances, most physicians would be happy to do extra cancer screening. And I've never found that to be an issue for insurance to cover either. Does that help at all, Cassandra? Or I can talk more about that.
That pretty much that did it. We're good. Thank you.
Okay. I was going to say, I'm happy to talk further on that otherwise. Um, so all women aged 21 to 65 who have a uterus, as we talk about, need cervical cancer screening at least every 3 to 5 years. Women who have had their uterus and their cervix removed, like a hysterectomy, um, need to discuss with their doctor if they actually need cervical cancer screening or not. Some women who have always had normal cervical cancer screening in the past can actually be done if they don't have cervixes anymore. Other women might need screening, and so that is an individual conversation to have with your doctor. For most women, we do stop screening at the age of 65. However, there are people who have certain medical conditions. If you've had abnormal pap smears in the past, or if you've had any postmenopausal bleeding, there are reasons that we would screen women after the age of 65, and that's something to talk to your doctor about. So cervical cancer, as we said, is largely preventable because we have regular cervical cancer screening. And about 1/2 of the cervical cancer cases occur in women who've never had cervical cancer screening or a pap smear. It usually takes 3 to 7 years for high-grade changes in cervical cells to become cancer. And so that's why this cancer screening can detect these changes before they become cancer. Over the last 30 years in the United States, the number of cases of cervical cancer and deaths has actually decreased by about 50%, and that's because of cervical cancer screening. So say you go and you get your pap smear done, and then your doctor says, now you have an abnormal result. This is the most important step, is now we have to follow up on this test. Um, Depending on, we look at two things. So we look at both your HPV, if you have the HPV virus or not, and then we look at what your cells are. And depending on those results, your doctor may ask you to wait another year and do a pap smear again and to see if the changes are gone or if the virus is gone. They may also say, come in and we need to look at your cervix a little bit closer and do a procedure called a colposcopy, which is where we do another pelvic exam. So we go back in and we place a speculum and we look at your cervix right here. But then we have a microscope that helps us magnify these cells, and we can look and see if there's anything abnormal. And if there's anything abnormal, then we can take a biopsy. Early detection of these changes can be treated by removing just the abnormal cells, not necessarily the whole uterus, and we can prevent cervical cancer that way. And once you've had one abnormal pap smear or cervical dysplasia, there's a chance that you might need more frequent individualized screening. Does anybody have questions about this or want to talk anything more about any of these procedures, such as a colposcopy or a biopsy?
None here, and I'm looking on Facebook because I have it going live there, and there's no questions there, so you can continue.
Okay. So cervical dysplasia and cancer don't usually have symptoms. And usually if you have these symptoms, it's a sign that the cervical cancers may already have spread. So if you notice any symptoms that can occur are abnormal bleeding, watery discharge, bleeding after sex, and heavier periods. If you ever have any of these symptoms, it's very, very important to see your doctor. Most of the time, these symptoms do not mean that you have cancer, but all of these are very abnormal and should be evaluated and worked up to make sure that they're not cervical cancer, uterine cancer, an infection, or anything else. So just takeaways for today are it's important to get your cervical cancer screening done by doing your pap smear with your doctor or healthcare provider at minimum every 3 to 5 years or more frequently. And if you have an abnormal pap smear, it's very, very important to follow up with your doctor. These are my references. And so I used mostly ACOG, which is the American College of Obstetrics and Gynecology. They have a whole bunch of free women's FAQs about all sorts of women's health topics that I really like looking at for good scientific medical advice. And then I also looked at both the CDC and the National Cancer Institute. That is all that I have today. I really appreciate your time and you inviting me to come speak with you. Happy to take any questions.
Okay, well, first let me say thank you um, for taking time out of your schedule and doing this for us in the evening time. And I appreciate that. Top Flight is always um, looking for new providers and same providers to come on every year and give us updated information on the care for not just women veteran and women in the community, but also the men as
Mhm.
well. We've had several men on our health awareness classes that I told them, I was like, you have mothers, sisters, daughters, cousins that are women. There's some things that you can take from what we present and share with them. I don't know if any of our viewers on Facebook have any questions or anyone that is on our Zoom. So, what I'm going to do, if anyone on our Zoom have any questions, I will stop recording so that you can share and I'll come off of Facebook. And so let me do my intro and then don't hang up no one because then I'm gonna stop recording. So once again, I would like to tell everyone in Facebook land, thank you for joining us and listening to Dr. Bhakta talk about preventing cervical cancer. Take take what you can from it, utilize it, implement it, and share it with others. This is recorded and it will be on our YouTube channel, which I will upload onto Top Flight Defense Incorporated YouTube. Nope, I thought we had someone else. But continue to follow us on Facebook, Instagram, Twitter, and what's the other one?
TikTok?
Facebook is, oh, and then our YouTube channel. But with that being said, thank you all. I'm sending out big hearts to everyone on Facebook and in the listening and viewing area. So stop here.